One of the best ways to close the disparity in knowledge between healthcare providers and the patients is to effectively use AI. And what I like about it is there are ways that as a healthcare provider, I may engage with AI.
Welcome to the Johns Hopkins University Medicine World Infinity, The Power Shift. It's a podcast where we try to interview a lot of experts who are connected to the community, folks who understand some of the challenges that marginalized communities have. And today we have an extraordinary guest, and I can say that because I've known her for a couple of years. I've seen her in action for a couple of years. And I know that her work is beginning to revolutionize sort of how we think about and negotiate in healthcare. I often refer to her as insightful, funny, and I might add witty. Professor Stacey Lee, excited to have you here. Professor Lee is an expert in law and ethics and healthcare negotiations, and you'll see some of that evidence today when we chat. She's also a distinguished academic professor who's passionate about equitable healthcare, making her an essential voice in discussions around healthcare, law, and ethics. But it is important to know that her impact and work goes beyond the classroom. Her research explores how pharmaceutical companies shape and access medicines, and she's a sought-after expert on healthcare negotiations. What also sets her apart is her ability to take complex issues and make it accessible and actionable. And I saw that firsthand when Stacey led a workshop for young entrepreneurs in my program. I've had the pleasure of working with her and the MBA program. I think today's conversation is going to be well worth its gold, and look forward to the feedback and questions after we post this conversation. Professor Lee, thank you for being here. Really appreciate you taking the time. No classes are in session and you have a lot else going on, but hopefully some of this can be used for one of your lectures also. We'll see.
Thank you very much for that kind introduction. I will try and live up to being witty and insightful. So we'll see how I fare.
Okay. Your first question, let's jump in here. If someone from Southeast Washington, D.C. were to stumble on this podcast, can you tell me why they should stay and listen to this from your perspective?
Yes. So in talking about my background, you really honed in on the two things that I'm most passionate about, and that's equity and access and how it relates to healthcare. And if you look at the health communities in and around DC, Maryland, Virginia, the challenges focused or faced by Southeast DC are large. What I hope we get into over the next 40 or so minutes are what are actionable strategies that people can use to increase their ability to get equitable, fair, and access to healthcare. I think a lot of times we really look to institutions and leaders to help change and close the gap in healthcare disparities. And while I am very passionate about doing that, what I really want to focus on and what I think is worth sticking around for is, as an individual, what can you do to make sure that you're getting the type of healthcare that you're entitled to?
Thank you. This gets to the point, and I know folks are going to stick around, but let's lean back into your upbringing. So in addition to your professional training and academic background, is there something in your upbringing? Where did you grow up that has led you to this? And tell us a little bit about who you are.
Well, what's interesting is I'm a military brat. So I grew up all over the place. And so my really intersection with healthcare and seeing the disparities of it didn't come till much later, because in the military, everyone has healthcare. And what was interesting for me is that was the perception or the understanding that I had. And it was only after moving to Baltimore, beginning to practice healthcare law, that I got real insight into the fact that the way that I grew up, the access that I had is atypical. And as I got more into healthcare, I became very attuned to the way healthcare policy and law shapes people's access. There's a reason why I left practicing healthcare, but I got very good at making sure that policies, regulations, and practices were enforced in a way that really benefited more of the healthcare institution side rather than in all areas the patient-centric side that I focus on now. So I really think that background has made me more passionate and perhaps a little more insightful into the levers that are available to ensuring that people get the care that perhaps policies, institutions don't always lead with.
A couple of years ago, a statement from someone in DC struck me when she said, "I have health insurance. I thought I can go to the doctor and maybe I'll get a $5, $10 bill co-charge or something like that." And a couple of weeks later, she's home and she opens her bill and it's a $800 bill for service. She said that jaded her in such a way that she felt she couldn't trust the system. I think I hear a little bit of you saying, "Hey, we can help folks figure that out." And, and while I can get down a rabbit hole about the American healthcare system compared to other industrialized countries, I'm not going to go there. Take us through what that grandmother should do and can do to, one, be prepared for and understand how to negotiate, what are the health costs that she or she should expect, and how to prepare for that and how to negotiate.
That's a great question. And there have been some policy and legislative changes in the No Surprise Act. There should be transparency in terms of how much is this visit going to cost me. The EOBs should be friendly and understandable. And to the extent that there aren't, how well versed are you in what are the resources out there? Who do you call to help you decipher that bill? And I really push for first transparency in billing. However, you've got to have a lot of patience and a fair amount of knowledge in knowing what's appropriate billing, what isn't. But there are within health insurance companies, there are within the state level, ombudsmen, healthcare advocates, many of whom are free, that can help walk you through beginning to understand what the charges are for. So at a very beginning level, can you explain to me what I'm being billed for, what I can expect to see? Now, while the healthcare provider in and of himself or herself may not be well versed in that, they can and should send you to someone who can walk you through. A lot of it, unfortunately, is just having the resilience and the determination of sticking through it. What I see too often is people get the bill, they're overwhelmed by it, so they put it aside and don't deal with it. That just results in an escalation of fees and other bills. So ask for, when you go to your provider's office, an understanding of, or what should I expect to see in the charges? If I have questions, who do I contact? And then at the state level, there are services out there that can help walk you through and understand, and in some cases, even help you to negotiate and reduce down, because at the end of the day, healthcare is a business. And if I'm not going to pay any of my bill, the hospital's not getting anything. However, if they're willing to work with me and I will pay a portion of it, some is better than none. So there are resources out there to help you do that.
Really good nuggets there, transparency in billing, and there's been some policy changes. But process oriented or in real life, I wanted to go to the doctor. I pick up the phone, I call my provider, I set up an appointment. Are you saying that they should tell me at that time what my bill is going to be, what I should expect? Or do I wait until I actually walk into the doctor's office, or do I wait until I actually get the bill? How do I balance that need to, hey, I made an appointment, I got on the books, my primary care, it's been 3 months to see him or her, and now, what's my next step? What should be my first step?
So having that conversation can happen at any point along the series of events that you've told me. But as I mentioned, I'm for healthcare advocacy, which means to me, I prefer not responding in a defensive way. When I make the appointment, I'm going to have the conversation. What can I expect my charges to be? Then, depending on my answer, I'm going to reiterate that conversation when I get to the office. Either it was, I have an understanding that my bill will be in the range of X. Has there been any change, any additional information, lab fees that may accompany this visit that I need to know about? So I'm going to have the conversation when I make the appointment. I'm going to have the conversation when I show up at the appointment. And then I'm going to have the conversation at the end of my appointment. And please document. Write down what you're being told. And there are a number of devices out there. Technology is our friend. While recording conversations, you do run into difficulty with that, but doing a quick memo to yourself of your understanding of what was said, the person's name that you talked to. And then when you get the bill, does it align with what you've been told, hopefully at 3 different points: when you made the appointment, when you showed up to the appointment, at the end of the appointment? And if there's a difference, then you have an informed basis to have the conversation to either appeal the EOB or to say, this is not in alignment with what my expectations were. So again, a lot of it is arming yourself with the knowledge. And there's a real disparity of knowledge between what you know as a patient, what your insurer knows, and what the provider knows. Collecting information at each pivotal point and recording it so you can be informed, I think, is just crucial.
Having a conversation this weekend with a dear friend of mine who is a tech executive, number of well-known companies. And we were talking about the opportunity that AI is presenting now in this space. And it led to us talking about, for years, even before AI, I have been trying to get my health records, electronic health records, and trying to use that as a tool. Is that available? Is the AI make it more accessible today? How should Browne from DC, from Baltimore, or anywhere begin to think about those tools in the negotiations that you've just mentioned?
Oh, Al, that to me, AI is a game changer. I do understand that people have different levels of comfort with AI. What I like about AI, and I have older parents, and I try to encourage them. One of the best ways to close the disparity in knowledge between healthcare providers and the patients is to effectively use AI. And what I like about it is there are ways that as a healthcare provider, I may engage with AI. For me, when I'm going with my mom to her dialysis appointment, I'm really clear. Hey, I don't have a medical background. Please explain this to me on the level of a high school senior. What are the questions I should be asking? If it throws out a medical terminology, hey, don't understand what that's about. What are good follow-up questions I should ask at the end of the appointment? If I were a healthcare provider, what should I be telling me? It's these types of questions that can allow you to go into your appointments as informed as possible. Because again, negotiation isn't just about the costs, which we've been talking about. It's about what type of treatments am I being offered? What type of rights do I have? And we may get into this later, but I had the opportunity to care for my dad the last 18 months of his life. And the amount of information that healthcare providers provided me at the end of his appointment was embarrassingly little. It was only after they knew I'm informed. It's going to take more than the 5 minutes to get me out the door. The more engaged you are, the more information they will reveal. But if they can get you out quickly, sometimes they do.
Interesting. You mentioned caring for your dad. You want to share any of the unique challenges that you saw? Obviously, you're prepared to deal with them and can manage that. But given that, what are my audience going to get based on that experience you had? What are they going to be challenged with? Anything jumps out at you want to share now?
Sure. I had the opportunity to do a TED Talk a couple years ago about the patient's voice and the importance of being informed and knowledgeable when you go to your health appointments. The kind of follow-on to that story was I got to take care of my father. And my dad had leukemia. He was on dialysis. He had stage 4 pressure sores, and he had Parkinson's, and he lost the ability to ambulate. Now, for my dad, I was very fortunate in that he was a VA, and the VA has a wealth of services, but you better have the fortitude and the time to invest in making sure that you get all the services that you're entitled to. So that was step one, just really becoming knowledgeable of what he's entitled to. Then for me, we would have to call the paramedics from time to time. And because my dad had dementia, oftentimes he goes in the ambulance and there's a gap between when I would show up. I made a laminated card of what medications he was on. The last time that he was in the hospital, what was he there for? I had all of this contact information. My goal or my responsibility was to shorten the conversation so they could get to the care part as quickly as possible. And I'd love to say that when I walked into the ED and I was dealing with the nephrologist or the ED doc, that they would engage with me as a person who was well-versed and did home dialysis for him every day. But they didn't. So I needed to do things to shorten the conversation. And at the risk of sharing too much, there was one time when my husband accompanied me with my father, and he presents a little differently than I do. And the way the healthcare providers engaged with him, the information that was provided, the questions that was asked, and we were both wearing sweatpants and sweatshirts, so it wasn't an attire thing. If you're in Southeast DC, if you're a person of color, if you're a female, you need to go into these healthcare situations with as much knowledge as possible so you can be taken seriously and be provided with the actionable information to care for yourself or your loved ones. Because until I was talking about his home dialysis regimen, until I could name his medications, their level of engagement with me was not as informative as it needed to be, to provide the type of care that my father was entitled to.
First of all, sincere apologies, condolences, and that your dad had to, and you had to care for him during this time. But I'm glad he had you. He had a negotiator. He had someone who
Thank you
understands
very
the
much.
system. So much there to unpack. And I'm thinking of our audience, and you did mention a couple of things with regards to knowing medications, understanding that. So many of us walk into the room and don't even know what medication they themselves are taking. and can't, reiterate that to the doctors and nurses to show a sense of knowledge and comfort and readiness. Any resource that you can think of that it pointedly would help me, help my audience know where they need to start looking to become as knowledgeable as they should be before they walk into that room. From going to the insurance websites, that's their website, they're telling me what they want me to know. Are there other resources that my audience should be looking at? Just one or two that they should think about as they begin to pursue caring for themselves and as you say, being patient ready.
Well, it all depends on how you like to receive information. For me, even though I'm a lawyer by training, going through insurance sites and reading through the warning labels on medications, it can be a bit overwhelming. So for me, I start with when I'm given a new prescription. What is this for? Is there anything through diet or exercise? Because I get that from a provider's point of view, handing me a bottle of pills, and from a pharmaceutical manufacturer's point of view, not curing, but managing for the rest of my life, whatever my ailment is through medication, makes sense in terms of profit, in terms of ease and the ability of a provider. If you have high cholesterol, it is much easier for me to give you a prescription. That way I don't have to worry about whether or not you're exercising or eating oatmeal. So, is there another intervention? With this medication, here are the other medications that I'm on. Is there an interaction? Because the warning label on the medication is going to say, don't operate heavy machinery, don't drink with alcohol. However, what is its interaction with the other medications that I'm on? I'd want to know that. And for me, when you go to your pharmacist, you have the opportunity for a consult. They have a wealth of knowledge. So for me, I try never to go to the pharmacy right after rush hour when everyone's trying to pick up their prescriptions. But if you have time at Saturday, 10 o'clock for Walgreens or another time, can you explain to me, here are my medications, what are their interactions? What should or should I not take this with? And for me, I was really upfront. I'm caring for my dad. His ability to articulate if he is in pain, if the medication is not working, is not a conversation we can have. So what do I look for? In terms of urine output, in terms of pain, in terms of fluid retention, what are the things that I should be looking at as these medications are combined? So it is really being incredibly inquisitive. And there are all areas of our life where we ask a ton of questions. When my 17-year-old comes home on the weekends, I got tons of questions. Use that skill set, that level of engagement, of inquiry, and stop defaulting to the assumption that if there's something important that I need to know, my healthcare provider or my pharmacist or my insurer will tell me. That is not the case. And priming those conversations by using AI, by doing internet searches, is an incredibly powerful first step.
I hope that's registering for folks and taking note. Too often we feel, well, I've heard my grandmother say, I don't want to be a pain in the what to the doctors. And they have this reservation about asking questions and pushing for the answers and clarity. And that can be done in a friendly, in a interesting way that it doesn't come across as bratish, but they refuse to do that. So I think that's a good point. All right, folks, we've got to ask those questions. We've got to think about it. And it's their job to provide you with clarity around those answers. So good to know. You are pushing and negotiating and sharing tools for the patients now who are going in for care. Are there other big things we should look for that's happening on the other side? Are there certain business practices that are happening that we need to be paying attention? Are there government policies that are now helping to address some of these things that you were saying, hey, Al, you and your audience need to know this and need to do this. What's going on the other side of that discussion that we should know? That would be helpful.
So at the policy level, there are always interesting things going on. I am very excited about, for the first time, Medicare and Medicaid will be able to negotiate drug prices. And while this is very still in its initial rollout, and there's been tremendous backlash and litigation filed by pharmaceutical companies who are not interested in having this, that is coming down the pike. So that's something that we should be aware of. But the answer to your question is, and perhaps it's a little bit of skepticism on my part, the inner workings of pharmaceutical benefits managers that help set the prices for drugs, for insurers, for the government, their willingness and focus on addressing this right now, I still think has a long way to go. One of the things that I really focus on are what are the points of direct engagement? And for me, that's providers and patients. And while I've talked about what a patient can do to educate themselves, I think that's only half the equation. And the book that I'm writing on healthcare negotiations is very much focused on, hey, providers, hey, insurers, how do you begin to reorient the conversation that you are having with your patients? Healthcare, I think, unlike other industries, has a bigger shared community or common set of goals: improving patient outcome, improving the quality. So I think that you have providers that are very interested in, how do I better communicate with the patient? How do I tailor a patient care regimen that's consistent with a program that they will follow? So I've begun to look at ways to help reorient the ways that providers, health insurers, researchers, postdocs, healthcare professionals across the spectrum engage with patients and with each other, all in the goal of providing more effective healthcare.
Helpful, very helpful. You led me to a point I hope to get to later in the conversation, but your book, it is coming out. Any other nuggets that you can share? Because why should we line up at Barnes and Nobles to get a copy of that?
It's for healthcare professionals. And what the impetus for this book is that so much of medicine is focused on, and if you look at medical school curriculum, is focused on the procedures. And that's great. However, learning how to do a triple bypass or learning how to prescribe the right medications, that's only at best half the equation. I've got to take the medication. I've got to follow my patient care plan. And so often there's a disconnect in the pivotal conversations that have to accompany the delivery of care. And what I found was the most effective way to do that is negotiation. So being focused in that, I was like, okay, these are conversations, but really, once you get out of a paternalistic mindset, they are negotiations. How do you negotiate with me to follow the treatment plan? As a patient, how do I negotiate the type of access, alternatives, and care that's available? And when I began to look at the negotiation literature, I was a little disheartened, because when you look at negotiation, it's usually about, how do you buy a car? How do you negotiate your salary? For you to have effective negotiation skills in something as complex and nuanced as healthcare, it requires a radically different set of skills for a number of reasons. First, the healthcare provider. The healthcare provider who's dedicated themselves to be in healthcare is not the used car salesman. Their mindset is fundamentally different. And I used to really struggle at how do I convey this? And one of the things that came out of the pandemic was the perfect example. In the early days of the pandemic, there was no vaccine. PPEs were very low. You had hospitals reusing masks. You had healthcare providers doing double and triple shifts. In no other industry, you did not see across financial institutions, heroes work here. You didn't see those banners across law firms. You saw those across clinics and healthcare because the people who are dedicated to providing healthcare are fundamentally different. The sensitivities, the mindset, the dedication that they give is a unique perspective. So the very transactionally based healthcare or negotiation strategies doesn't graft well into healthcare. So what's the proper approach to have? Because at the end of the day, I'd love to say that healthcare is just about providing care, but it's not. There are three pillars that make up our healthcare system. There's the business of health, and that's really what we focused on in the beginning part of our conversation. Healthcare is profit driven, and insurers, pharmaceutical manufacturers, hospitals need to turn a profit. So that's one aspect of it. Then you have, and I consider that like the boardroom, the negotiations that very much drive the business of health. Then you have what I consider the operating room. Healthcare has become so specialized. When you have cardiologists and radiologists and nephrologists that all have to coordinate the care to take care of someone, they all come from disciplines that have very distinct viewpoints on what should happen first to treat the patient. Coming up with a treatment plan requires negotiation among those specialties. So how do you do that effectively? I consider that the operating room. And then you have the exam room. All of that has got to be translated into a way or a message that I get and understand, and has to be negotiated against my priorities. So while my primary care physician is saying I need to cut back on my red wine and my fried foods, I like those things. So how can we have a negotiation about that? So the book really focuses on the need to be trilingual in healthcare. You've got to be able to effectively negotiate within and across these three pillars: the boardroom, the operating room, and the exam room. And only by having the negotiation skills that are specifically tailored for healthcare and its complexities can you effectively deliver care.
If I heard you correctly, you said the book is primarily for healthcare professionals.
Yes.
But then you laid out the business of health, so that the boardrooms act, and the operating room, and then the exam room in terms of the negotiation pieces that exist. There's three pillars of negotiation in healthcare. And the sensitivity to recognizing that healthcare has a different kind of sensitivity in its negotiation and its service and support. So I'm advocating for the next book to be for the patient, not for the So I hope we could get to the next book that really breaks it down for that person. And in that context, how do I, as in representing my audience today, how do I, outside of this, you talked about point-to-point, patient to provider negotiations. How do I reduce the number of point-to-point negotiations I have to do? In other words, what preventive techniques do I need to negotiate in order to reduce the number of times I do have to have that negotiation with my provider? Any ideas around that preventive care negotiation is kind of what I'm trying to get at here, if that's a real question.
I think that's an excellent question. And I'm always for how do we shorten the conversation so we can get to the treatment part. So there are several things that I think are important. First, and this is a negotiation strategy that I think very well is played out in healthcare situations. The first 5 minutes that you're meeting with your provider for the first time, it's incredibly important. It's during those first 5 minutes that they are forming a ton of opinions about you. Are you knowledgeable? Am I going to be able to, like, here, shove a script at you and get you out of my office? Or am I going to have to slow down, explain how knowledgeable are you, and how much am I going to really have to explain and help you be an active participant in your care? So for me, when I shape those first 5 minutes, I make sure that when I come in with a notepad, and that's just day one. And within that notepad, I've got my questions written down that either I've gotten from Google or AI, or just general questions that I have. I take control of the appointment. Their responsibility is to educate me on my health. And if I don't leave feeling more informed and being able to be an active participant in my health, then that has not been, for me, an effective meeting. So the first 5 minutes, I come in with my notepad. Hey, I'm having chest pains. It started here. It radiates down here. I'm interested in what type of treatment will allow me to, what are the things that are most important to me? At the end of the appointment, just so I'm clear, my understanding is based on what you've told me, I need to do X, Y, and Z. If I do my part, what will I see? So I try to go in as informed as possible during those first 5 minutes. I set the stage of, hey, this is not where you get to verbally vomit on me a bunch of medicalese that I don't really understand, shove a script in my hand, and have me on my way. It is at minimum a dialogue, ideally an informed dialogue where I leave more informed, more involved in my care.
Formed dialogue. There is, so medical professionals carry this aura of invincibility, aura of they know the answers, they know it all. The communities I'm working in tend to have a respect for that in a way that I think prevents them from pushing on these questions and prevents them from walking in from being prepared. I hope that this conversations and others that we will have begins to enshrine within that community the importance of them being prepared and not just taking it at face value and not just accepting that because your doctor, whatever you say in the first minute is golden and that they've got to look up and negotiate for themselves. So I can't wait for us to, one, get your book and get the second version of the book directed to patients specifically. But for listeners who are inspired by this work and this conversation, what's a call to action that they need to take? Again, my community, and you've laid out sort of the things that they need to do specifically for themselves. Is there a broader call to action for that community to help them be more effective in the realm of healthcare negotiation? This month is Minority Health Month. I want to highlight this issue for that audience. So I am asking for a little bit more.
Yes, get involved with your community. Share your information. If you have a diagnosis, if there are other support groups out there, join them. Share your experiences. Get what they are learning. What are you doing? How do you engage with your healthcare provider? So I'm a huge fan of that. In addition, I can't discuss or challenge more the importance of coming to your health appointments informed. And you mentioned a very interesting point of the deference that many people, especially older people, give to the healthcare community in terms of knowing what's best. I want to challenge that and make sure that you come informed. Just by way of my own experience, went to my healthcare provider for a colonoscopy. because I was of that age. And I believed that I was of that age. And she said, oh, no, you don't need one. This was a couple years ago. She said, until you're 50. And I was like, actually, according to the New England Journal of Medicine, African Americans should actually get colonoscopies earlier. She pushed back against that. And she said, if you think you'd be more comfortable with another healthcare provider, please find one. Maybe that was perhaps me sending her after the appointment, the site to the article. We need to be informed. And one of the organizations that I'm involved with, and I really encourage, again, this type of outreach, is our health community, and it's with the Institute for E-Health Equity. And what they do is they partner with churches and other religious organizations and social organizations to begin to get a convergence of healthcare experts that can help people answer healthcare questions and put them in contact with community resources in the areas that you're in to get information to address and make understandable some of the healthcare information that you receive. One of the big passion projects that I have right now is disparities in healthcare can't be reduced until we can make sure that the interventions that are being offered meet our communities. And because there is such a low number of participants of minorities in clinical trials, some of the cutting edge research is not geared to who I am and what my particular needs may be. So really increasing minority participation in clinical trials requires that the trials and the communication is such that it resonates with our community. There's a whole history of perhaps why we've not been engaged in clinical trials, Tuskegee, but how do we begin to get active participants? So the organizations that I'm involved with are really focusing on some of the bigger faith-based communities to help reach out to the community to get participants, provide them the assurances that they need, because again, to make sure that we have that type of healthcare that we're entitled to, it will require interventions at a number of different points, from the provider level, being an educated patient, making sure that the healthcare protocols actually meet our needs. And so a multi-pronged approach is necessary.
You said something that it reminded me of a conversation I had with another friend. She said when she goes to visit a doctor and they ask her to fill out these forms, and forms are about her family's health, her mother's health, her grandfather's health, her father's health. She said she just put through it and said, I need you to talk to me first, ask me about me, my health, my habits, before you make decisions about my health based on my family history. And what say he? Is that a good thing to do? Or is that really important that they know that my dad was X?
That's important to the conversation. But last time I checked, the provider isn't treating her father. The provider is treating her. So making sure that, and I understand that information is perhaps necessary for your research or for whatever, you're having a conversation with me. And that goes back to what I was saying earlier. You control the conversation. And I get that there's medical information that they need. I can fill out that form and you can look at that after the fact. I'm presenting in front of you right now. And
yeah, that was one of the most powerful things I've heard. Yeah.
I don't want you to rely on a background to make certain assumptions about me, because the number of times that I've taken my mom to a healthcare provider for the first time and their go-to is, so is she diabetic? I'm like, ooh, newsflash, not every elderly African American is diabetic. No, she's not. So again, treat the person in front of you, educate yourself on my family history on your time. I don't like that being a short circuit for being able to treat common perceptions of the person in front of you rather than the individual.
We both know that conversations like this around healthcare and negotiations in the health space and care can go on and on for a while, but you have a class to go back to teach. And so I want to jump to a couple of rapid questions because I think it's really important the audience listening to this, begin to recognize the human side of you, the fun side of people that I interview and talk to. I know you mentioned one of your passion projects earlier, but outside of the specific professional passion project, what's a passion hobby? What might surprise people to know about you? Are you a daredevil, a National Geographic explorer? What is Stacey's project?
So something that they might be surprised. I am a trapeze artist, and I've been doing that and performing for about 10 years. So yeah, I really enjoy that. And yeah, I've gotten back into gymnastics. So yeah, that's something a little off the beaten path.
Gotten back into gymnastics, so sports and at least in my family, probably not for me, has been a big deal. Does that mean I can search and find trophies and awards recognized Stacey Lee as a gymnast?
Well, there's been about a 40-year gap in my gymnastics, and when I was competing, internet was not around. So similar to my high school experience, that only exists in my mind, which gives me, I guess, freedom to be as creative as I want about how good I was. But yeah, so I did gymnastics through high school, really enjoyed that. And as the kids have gotten older now, we have 17-year-old twins, so we're beginning to navigate the whole college admissions process. It's given me a little bit of time to get back to that. So that's kind of fun, that and circus arts.
Interesting. Good to know. What are you reading now? Who are you listening to on podcasts besides this?
Oh, of course I'm listening to this podcast. It is my number one. Let's see, what am I reading? I just finished, and it's been out for a while, so I'm a little late to the game on this. Atomic Habits. I just started that. And in terms of podcasts, I am a big fan of podcasts. So How to Become a Better Human, big fan of 10% Happier. In terms of writing, finding an online writing community has been interesting for me. So I listen to a podcast called The Writing Coach. And then, of course, I always try and keep on top of the news with The Daily from the New York Times.
Yeah. It's the best piece of advice you've ever received.
The best piece of advice I've received, I think, has come in the form of a couple quotes that have just really resonated with me. And the quote that I love the best is from Emily Dickinson. And her quote is like, dwell in possibilities. And for me, anything's possible. And I think my responsibility is to dream as big as possible and as often as possible. And Alex Huxley has a similar quote, though I'm not getting it exactly right, but he has said, today's ceiling is tomorrow's floor. So I'm always looking for ways to challenge myself professionally, personally, to be a better person, a better mom, a better human, better researcher, better academic. It never ends. And I think the gift that I've gotten to be a human right now is the ability to try and make change and make things better however I can. And luckily for me and Al, if there's anyone that I think just manifests this, it's you. It's just an undying desire and thirst to improve the world around me. And when I get to interact and intersect with people who are making positive change, it just spurs me on to do more.
Well said. Appreciate that. And I couldn't have put it better for myself. So I'm going to steal that. it drives me to a question around how do we balance this? I've been thinking a lot lately about all of the elements you just described: better human being, better professional, better parent, and all of these things that we have coming at us now. I ran into a friend this weekend at the car studio, and he said to me, "How isn't it too much information now in this age? How do we deal with that? How do you balance? What's your secret sauce for how do you balance all of these elements to be that better human being, to be that more effective human being?" And the second part of that question, and the last question, is an opportunity to dine with anyone, past or present. Who would that be? So tell us about how do you balance it, and then who would that be and why?
Yeah. So to balance it, I do think, and when I look at my kids, I just think that the amount of information that they have access to is overwhelming. So for me, and if you want, you can doom scroll all day. And I imagine if you did so, you would lose the will to get out of bed. I am very selective in what are the sources of input that will help me be a better person. And doom scrolling, the contentious interactions of Congress, the infighting, it's not going to help me. I get the news, I move on. And so I really try to limit myself to, as much as possible, more facts, less commentary, and surround myself with inspirational people who are heading in the direction that I want to go. And another quote that it's measure yourself by giants. So I make a real point of surrounding myself with positive people. I draw a little on, not the best Catholic in the world, but some type of faith-based community. I spend time with my family. And I think it is too easy in the age of technology to forget about just the indispensable connection of engaging with someone without technology and a one-on-one conversation. Those are the things that inspire me. And those are the things that help me with an occasional just not looking at the internet today. It's a news-free day. We actually get the hard copy of the New York Times, read it, and that's it. I know what's going on in the world. I'm going forward. In terms of, and I saw this question and it really inspired, who would I want to have dinner with?
Yeah.
And it's funny how you go full circle. When I was in fourth grade, I did a book report on Harriet Tubman, and the perspective was very much of a fourth grader. Now, 50 years later, she to me is incredibly inspiring because she ticks all the boxes of things that just really motivate me. So after she gained her freedom, made 19 trips back, and led over 300 people from being enslaved to being free. Talk about going back and uplifting your community, freeing your community. That's incredible. After that, if that wasn't enough, then she was a Union spy and she is the first woman in history to plan and execute a successful military raid in South Carolina with Colonel Montgomery. A raid led to the freedom of over 750 slaves. So, as someone who went to West Point, the ability to go plan and execute a military raid, phenomenal. Okay, so if that wasn't enough, after all of that, she then opened up a home that provided healthcare services to people with epilepsy, blindness, and paralysis. So she added the healthcare component too. So if there was, for me, ever a trifecta in a human being, she helped her community, led a successful military raid, and then went and incorporated providing healthcare at a time when that just wasn't on the map for anyone. I'd love to hear how she balanced it all.
I am hoping that someone listening to this podcast or this posted is aware of the virtual reality or the AI that brings back Harriet Tubman, well, make sure you're the first to know that it becomes available. It's not going to be as real, but we'll take what we can get at this point. That is a great lesson for me too. Didn't know that much about, didn't have her in that context. So good to
Yeah,
know.
she's phenomenal.
Professor Lee, this has been phenomenal in many ways. And I keep going back and looking at the questions I have, the ideas that I want to talk to you about, and I know we've run out of time. So let's do this. Where can our readers and listeners learn more about your work and reach you after this gets posted? And how might they be helpful to you in the mission? I know you talked a little bit about that, but where can they learn
Yes.
about you?
So if you'd like to learn more about me, obviously I'm on LinkedIn, but you can also go to my website, Stacey, Staceyb, Lee, Lee.com. That will tell you a little bit more about my healthcare negotiation efforts, and it will give you a link to my academic website if you're interested in learning more about my research and some of the publications that I have, and some of the interviews that I've given on a host of healthcare issues, ranging from the abortion ongoing saga to other major developments in healthcare, and a little bit about some of the constitutional law challenges that we're facing right now in terms of the current administration. In terms of what I'd like for you to do or how you can help, pick up the mantle and become an advocate. Ideally, an advocate for your community by getting involved, sharing your knowledge, but at a minimum, become a self-advocate. Go to your to your medical appointments informed. Ask questions. Don't be merely the recipient of information, but craft that as an ongoing and an engaging dialogue, and really challenge or ask questions. Your healthcare provider is there to be just that, a provider of information and knowledge that will help you take better care of yourself.
The MBA students at Johns Hopkins University, Carey Business School, and the Bloomberg School of Public Health are blessed to have you as their professor. I was fortunate to expose you and your skills and your life a little bit, not just through this podcast, but to some of the fellows in the Ward Infinity Accelerator. Stacey, we can't thank you enough. Can't wait to have you on again. Appreciate all that you shared and more. Thank you.
Oh, thank you so much for having me. And again, I would love the opportunity to come back. One of the most inspiring things is to be in a room of minority entrepreneurs who's, through their businesses and their initiatives, are really laying the groundwork to revolutionize the services, the products, and the things that are available out there. So I highly enjoyed it. I found it incredibly inspirational, and I do hope you invite me back.
Looking forward to doing so. Appreciate it.
All right. Take care.